In pediatric nursing, you'll need to know how to provide care to children at different age groups because each stage of a child's development requires a different nursing approach. So first, let's talk about the infant. When we're talking about infant developmental milestones, we're talking about children from the age of birth to 1 year. Now, whenever you're studying these developmental milestones, there is specific categories that you want to know for your exams. So to help us remember those categories for the infant, we're going to remember the word babies because we're dealing with babies here. So B is going to stand for body changes, all the body changes that are going to occur in that infant that you want to know for exams. And then A is for achieving milestones. Specifically, we're talking about motor and cognitive milestones, and we're talking about the specific months when they should hit those milestones. Then the other B is for baby safety. I is for interventions that you want to consider as the nurse whenever you're providing care to that infant. E is for the eating plan, and then S is for social stimulation, play. So first, let's talk about body changes. Okay, big thing you want to know about these infants is when those fontanelles are going to close. We have an anterior fontanelle and we have a posterior fontanelle. If you feel on a baby's head, you can feel the area where these fontanelles are. They feel squishy and soft. So the anterior fontanelle, it closes at about 18 months of age. The posterior closes around 2 months of age. So as a nurse, whenever you're assessing that infant, you're going to see if those fontanelles have closed. Also, you want to know about weight and length. Okay, what about weight? Well, you want to know how much they should weigh as time goes on. So remember this, at about 6 months, their weight should double from their birth weight. At 12 months, that weight should be tripled compared to their birth weight. So let's do a little quiz. If the baby was born and they weighed 8 pounds, how much should they weigh at 6 months? Well, their weight should double. So 8 plus 8 is 16. So about 6 months, they should be about 16 pounds. Well, how much should they weigh at a year, 12 months? Well, that weight should triple from that birth weight. So they should weigh about 24 pounds. Now let's look at their length. Generally, their length, they should be growing about 1/2 inch to 1 inch every month. So let's say our baby, when they were born, they were 21 inches. How long should they be at 6 months? Well, if you apply this little rule, they should be anywhere between 24 to 27 inches long. Then you want to look at teeth. Their mouth is going to start changing. So usually the first teeth to pop up will be those lower central incisors, and these are found in the bottom gum line in the middle, hence why we call them the central. And they tend to erupt in most babies around 10 months of age. Some get them a little bit sooner. Now, whenever we talk about the preschooler, school-age child, they will actually lose these central incisors. And they tend to lose those around 6 to 7 years old. And actually, my son has just lost his central incisors. Next is A for achieving milestones. So we're looking at specific months when they should be hitting certain milestones. And as we go through these milestones, I'm going to try to point out the ones that tests love to ask you about. So whenever you are assessing an infant, every well visit they come in or whenever you're providing care to them, you're going to look at their age and you're going to ask yourself, okay, are they doing what they should be doing at this age? For instance, if they're 2 months old, the baby should be doing these. If they're 4 months old, they should be doing these. So that's why it's really important we know these developmental milestones. So at 2 months, an infant should be doing the following. They should be moving their head from side to side. They should be able, with their eyes, to track people's faces, so follow the face or an object. They will be starting early language, like they will be making verbal noises like those coo sounds. A big thing that I personally love is they should be smiling by this age. So you'll see that. Also, they should be able to hold their head up when they're on their stomach. So tummy time is very important for these little infants so they can start getting those motor skills. Now at 4 months, what should they be able to do? Well, this is when the baby actually starts to enjoy play, especially with the parents. Now this is just very early play. Also, their cooing that they did over here at 2 months is actually going to transition into babbling, and they may start copying noises that the parent makes. Also, they will hold toys, maybe like a rattle, and they will start to reach for things. So that's when things start getting fun, when they start to reach for stuff. Also, they have the ability to start remembering faces and certain objects. And this is another big milestone that they do over here that you want to remember. This is when they start to roll over. So some things, whenever we're talking about safety, whenever they start rolling over, a parent needs to definitely be more aware of baby, because instead of baby just laying there chilling, now they can flip over and they can potentially fall. Also, swaddling, whenever you wrap the baby in that burrito type thing with the blanket, that's when you want to stop swaddling, is whenever they can start rolling over. Next is 6 months. So at 6 months, the infant should be able to set up with support. They will start to have stranger anxiety, so whenever people come around them that they're not familiar with, they will not like that, and they will display that in their face, and they may even cry, and they won't want to go to that stranger. Also, the babbling that they had before at 4 months is starting to progress, where they're going to have early vowel sounds in that babbling. Also, they'll be able to recognize and respond to their name, which is always so fun whenever they start to understand what their name is. And they will start to have fun looking at themselves in the mirror. So that's a little bit of play that they can do around this time. Then at 8 to 9 months, they can actually start to sit up without support. So over here, they need support, but over here, they don't need that support. They can actually set up and hold their own. Also, they start to crawl at this age, and they may start to stand by pulling up on an object and actually holding on to the object while they're standing. This is the beginning of walking, which they'll start doing a little bit later on. Also, a big thing that you want to remember in this age category is that they start to use the pincer grasp. Now, what is that? Well, this is where they use their thumb and their index finger, and they will go and pick up little small objects like Cheerios or something like that. Also, this is where they start to move objects from hand to hand. So you may be able to give them a little block and they can switch it from hand to hand. And they start to have object permanence. Now, what is this? Well, this is where they finally realize that when something disappears, it still exists. So this is where you can start getting a little more creative with play. You can hide objects and they can try to look for them because they know that they still exist. Or you can play peekaboo and they will start to enjoy that. And lastly, we have 10 to 12 months. So what should this child be doing by their first birthday? Well, they should begin walking. This is a huge milestone. So they went from crawling to now walking. They will be able to do this by either holding the parent's hand, and they will be able to take steps. Some children can actually walk on their own without their parents' help, but it really depends on the infant. And this is really the beginning stages of it. They're not masters at it. They're going to trip, they're going to stumble, and they're going to fall. Also, they should be able to follow very simple commands, like if you tell them no, they'll know they shouldn't do that. Also, if you tell them to wave bye, a lot of children, they can wave bye. So just very simple things. Also, they should be able to take objects and put them inside of a container, or they can take the objects and bang them together. So notice, as we progress with age, play has changed. They went from liking to look at themselves in the mirror, from playing peekaboo, to now taking objects and putting them in containers. So whenever you're looking on exams and they're asking, okay, you have a hospitalized infant, what's an appropriate play situation you can do with this infant? You'll want to know what you can do. Also, they should be able to say simple words like mama or dada. And this is when separation anxiety happens. So this is when the caretaker, the main caretaker, like the mom or the dad, is removed from the sight of that infant freaks out, does not like it, will cry until they can see their caregiver again. So again, you want to keep that in mind as the nurse that this starts around this age. Next is B for baby safety. Now there's some specific topics that you want to know for exams about baby safety that you're going to educate the parent about that you really have to watch out with these infants. So first is SIDS. This stands for Sudden Infant Death Syndrome. Now what is this? Well, this is where a healthy infant under the age of 1 dies usually in its sleep for some unexplained reason. They're not totally sure. But they know that if you do some preventative measures, that helps decrease the risk. So you want to teach the parent the following things. Number 1, the best sleep position. The best sleep position for an infant is on their back. Not their side, not their tummy, but their back. Second, you want to educate them the importance of avoiding smoking around that infant because that can irritate the respiratory system. Third, you want to educate them about removing extra items from the crib, like blankets, toys, because that can smother the baby's face. Also, the importance of not overdressing the infant when it sleeps. We don't want them to get really hot and sweat. That can increase the risk of SIDS. And then lastly, the importance of making sure that the parent doesn't sleep in the same bed as the infant. They can sleep in the same room, that's totally fine, but have the infant's own place where they can sleep. The next topic you want to educate the parent about is about shaken baby syndrome. This is where you want to stress to the parent that they never want to shake a baby because a baby's brain is very fragile inside of their skull. And if a baby is shaken, that brain in a sense will just rock back and forth up against the front and the back of the skull, and it can cause a traumatic brain injury which can lead to a severe disability or even death. So, caring for an infant can be stressful. So you want to tell the parent, if you're going through one of those stressful times, lay the baby down, make sure they're safe, and just take a break for a second. And you want to stress to never, ever, ever do this. Another topic you want to talk about is choking. From birth to 1, they are definitely at risk for choking. Whenever they're born, they're at risk for choking on breast milk, mucus that gets built up in their respiratory system. You need to teach them how to suction that out with those little bulb suctions. CPR, recommend that they take a CPR class. And then as they get older and progress, there's a risk of them choking on foods because around 6 months of age, that's when you start introducing foods. So you want to tell them to avoid giving them small, round, little foods like grapes, uncooked vegetables, popcorn, because the infant can get choked on that. Then we have car seat safety. Where's the best place for an infant to be whenever they're riding in the car? Well, in that back seat. And you want to put them in a car seat that is rear facing. So in a sense, they're like backwards in the car, and that is where they want to be. They don't want to be in the front, and they don't need forward facing. That comes a little bit later. And then burns. Burns becomes a big issue, especially when that infant starts becoming more mobile, where they're starting to reach for things, because that starts around 4 to 6 months and they get really good at it. So you want to make sure that they're not close to a stove while you're cooking. Watch those electrical outlets. Also the water. Some water heaters can get really hot. So you want to make sure that you have it on an appropriate temperature so the infant doesn't turn on the water and scald themselves. And then we have the whole rolling over issue. So here's your baby, it's born. They normally just lay there. They don't really move except their arms. And then all of a sudden, around the 4-month mark, they will start rolling over. It's exciting, but this is a time when that baby's starting to become more mobile and they can get hurt. So you want to teach the parent that this starts happening. You want to make sure that they're always in a safe spot, that they're not going to roll off and hurt themselves. And again, as I pointed out earlier, this is the time when you would want to stop swaddling them, because when you swaddle them, you put them on their back. But if they're starting to roll over in the middle of the night, they could roll over, they could get their face on the mattress and couldn't be able to breathe. Next is I, for interventions that the nurse wants to consider whenever this infant is hospitalized. So infants, whenever we look at Erickson's stage of development, they are in the trust versus mistrust stage. So I would commit that to memory. And in a nutshell, what that means is that that infant is building trust. So building trust with their caregiver that their needs are going to be met. So as a nurse, we need to help the infant in this stage and meet those. So what can we do? Well, an infant, how do they tell you that they need something? They cry. So it's your job to figure out what's wrong. Do they need a diaper change? Are they hungry? Are they in pain? They have gas? What's going on? So you're going to respond differently to a younger infant compared to an older infant. So to help build this trust, whenever they cry, you want to respond to that promptly and investigate what's going on. And you want to soothe them. So for the younger infant, how a young baby is soothed is that you rock them, you swaddle them, you hold them, or you give them the ability to suck. All those things are going to help soothe them and calm them down. Now with the older infant, you're going to look at some other things that could be causing their crying to help keep them calm and build that trust. Because remember, as they got older, they started experiencing stranger anxiety, separation anxiety. So for separation anxiety, what could we do? Help keep that parent there, their caregiver there, so it keeps the infant calm. Like whenever we're assessing them or something, keep the infant on the parent while we assess. That'll help calm them a little bit. Also, with stranger anxiety, how can we help with that? Well, this infant starts to recognize, hey, I don't know you and I don't trust you. But to help with that, the same nursing staff can be scheduled to provide care to that infant. And also play starts to become really important as this infant gets older. So depending on their age, you want to implement certain play strategies with them, give them time out of that crib, out of that bed, to play. Then we have E for eating plan. How's this infant supposed to eat? Well, breastfeeding is gold standard. That's the absolute best for an infant, and you want to educate the mother about that. So the first 6 months, that's all that infant needs. They don't need any extra fluids or food. Just for the first 6 months, exclusively breastfeed. And then after those 6 months, continue breastfeeding, but you can start implementing food over time. Now, the American Academy of Pediatrics recommends if an infant is exclusively breastfed, that's all they have, they don't have formula or anything, that they should be supplemented with vitamin D 400 international units on top of their breast milk to help with those levels. Now, if they can't breastfeed, the next best is formula that has iron in it. And some things that you definitely want to tell them to avoid during those first 12 months of life is that they don't need any cow's milk or honey. And lastly, S for social stimulation. So we're talking about play. Now, infants aren't big about playing with other children, of course. They're just not there yet. They're more of independent players. So they do what's called independent play. Now, it starts out with observation during the birth to first 4 months of life, and then it progresses to interaction where they want to interact with their environment. So with observation during that birth to 4 months, what can you do to play with them? Well, you can just be there with them because they love to look at faces, and they also love to look at high contrast items. Also, they love the sound of voices, so being sung to, talked to, that is how they play. And then after 4 months, they start to break out of that and they start to interact with their environment. So this is where toys start coming in handy, like letting them hold rattles, hearing that shake of that rattle and moving that. Blocks, hitting the blocks together, putting them in a bucket and just hearing that noise and hitting them together. And then the push toys that you can buy, because remember, they like to pull up and stand and push, and that's going to help build those muscles and that body up as they progress for whenever they start walking. And they love, again, hiding objects, playing peekaboo. Now let's talk about the toddler. The term toddler typically includes children between the ages of 1 year to 3 years. Now, toddlerhood has a lot of changes with it. They are changing physically, especially in the way they look. However, they are changing mentally, and they are developing their fine and gross motor skills. Now, the toddler is becoming aware of their environment compared to the infant. So because of that, they want to test that environment out. They want to explore it. And also, they are developing this term that I would definitely remember about the toddler called autonomy. And this is where this toddler has figured out, I am an individual, I'm separate from my caregiver, which is usually the mother, and I have my own will. I want to be independent and I want to do things that I want to do. So they will try to test that out. They'll go back and forth between being independent and dependent. Also, they have realized that their actions influence others around them. So really, a lot of things that we're going to be talking about with categories about the toddler that you want to remember for exams is going to be dealing with this autonomy and how we can foster that. Now, the toddler is going to change in their appearance. They're going to lose that baby look to them, and they're going to start looking more like a little child. And as you can see here on the left, here's a picture of a baby, and then 3 years later, this is what they look like. And it's absolutely amazing to see the changes that a child undergoes within that first 3 years of life. Some fine and gross motor skills that the toddler is learning to do is that they are learning to throw a ball ball to another person. They can also take that ball and kick it back and forth. They're also beginning to learn how to run, and they can climb on things. They can also take like a marker and scribble on some paper. They love coloring and drawing. They may not be good at it, but they like doing it. Also, they like to take blocks and build them. They can also say hundreds to thousands of words, and they can talk in 3-word sentences. Now, first, let's talk about the body changes of the toddler that you want to know for exams. So first, their weight. So a toddler by 24 months, so about 2 years, should be gaining anywhere between 4 to 6 pounds per year. So the toddler should be about 4 times their birth weight. So let's say we have our toddler here. Whenever they were born, they weighed 7 pounds. So how much should they weigh by the age of 2 to 3? Well, they should be 4 times that. So 7 times 4 is 28. So they should be about 28 pounds. Now the average weight can vary based on if they're a boy or a girl. So the average weight for a toddler girl that's about 2 years is about 26.5 pounds, and a boy it's 27.5 pounds. Next is their height. So by 2 years of age, the toddler should increase by 2 to 3 inches per year. So a 2-year-old is going to be about half their adult height. And a typical height for a 2-year-old is anywhere between 33 to 34 inches. And then there's head to chest circumference, and this measurement is actually going to become equal at about 1 to 2 years of age. Now remember, with the newborn, the head circumference was actually 1 to 2 centimeters larger than the chest circumference, but around 1 to 2, it evens itself out. Now let's take a deeper look into the main concepts that you need to know about the toddler for exams. And to help us remember those concepts and to tie it all together, let's remember the word toddler. So T stands for temper tantrums. O stands for on the move, and we're talking about safety because remember that toddler loves to explore their environment, so that puts them at risk for hurting themselves. D stands for diaper to potty transition. A big thing that you want to remember about this toddler is toilet training. And then the other D stands for developmental stage theory. L stands for loves to say no. The toddler loves to tell you no whenever you tell them to do things. And this is a term called negativism. E stands for eating plan. And then R stands for the 3 R's you want to remember about the toddler, which is rivalry, and we're talking about sibling, regression, and then ritualism. So first, let's talk about T, temper tantrums. Why do these occur? Well, you've probably heard of the terrible twos, and this is the time when these tantrums like to manifest themselves. And the reason they occur is for several different reasons, but one of the main reasons is it goes back to that autonomy, where the child is becoming independent, they have their own will, and they want to do things, and they can become easily stressed or agitated. For instance, it can be as simple as trying to get into a container to access their toys, but they don't have those fine motor skills to get in there very properly, so they get really mad, they throw it, and they have a tantrum. And they're just really still immature in how they process their emotions. So how a tantrum may look is that they scream, they cry, they throw themselves on the ground, they hit, etc. So where you come into play is with education for the parent. And what you want to educate them about is that this is normal part of childhood and it will go away. Whenever a tantrum occurs, you want to stay calm, even though that's really hard to do sometimes. You also don't want to give in to the child's request of why they're having that temper tantrum, because that's going to teach them that this works and they will keep going back to that. And you don't want to try to reason with a toddler because they're not mentally there to reason with you. They're not going to understand it. And whenever they do this, you want to ignore it, but you want to stay close with them. You just don't want to leave them. Just let them know that you're there still, but just ignore their behavior and protect them from hurting themselves if it's escalating to that point, and be consistent in your approach. Now, what are some preventative measures? Because believe it or not, there are some things that you can do sometimes to prevent one of these tantrums. So a toddler's attention span is really short. So whenever you perceive that a tantrum's coming on, you can actually distract them. So divert their attention to something else. Also, check for triggers. What is something that's going on with that toddler that makes them more susceptible to a tantrum coming on? Like, for instance, are they hungry? Are they sick? Are they tired or overstimulated? That could be something you wouldn't want to do with them. Like, you don't want to go take them grocery shopping with you because they might have a meltdown. Also, giving them choices helps with their tantrums because they're developing that autonomy. So some things that you can do, let's say that they have a tantrum before they go to bed. Well, you can maybe give them a choice, like, for instance, it's time for bed. We can read this book or that book. So they get to pick which book they want to read before they go to bed. That might help. Also, praising them for their good behaviors so they can start to learn this is good behavior, this isn't so good. And preparing them ahead of time before there's a change in like an event or something. For instance, I can remember with my first son going to the park. You know, they're running, they're playing, they're having fun. But whenever it's time to leave, they don't want to leave. And if you abruptly throw that on them, they can have a tantrum. My son would always just run away, and I would have to run through the park to try to find him. And instead, I figured out that if I prepared him ahead of time, it was so much easier to leave the park. So for instance, you could tell the toddler, okay, we're going to be leaving the park, but I want you to go down the slide 3 more times, and then we're going to go home and get ice cream. Whenever I would do that, it would work like a charm. Next is O, on the move. So we're talking about safety. So our toddler has increased in their mobility. They're very curious and they're into everything. And at this age, there is a huge risk of death where they accidentally hurt themselves. So you want to educate the parent about those things that tend to hurt a toddler. And to help us remember those, remember the word dangers. So D for drowning. Huge risk for toddlers is getting into water unsupervised and they drown. Even keeping your toilet closed, because some toddlers have, believe it or not, drowned in a toilet. A for automobile accidents. So with this, it ties in car seat safety. You want to make sure that the toddler, if they're under 2 years, that they are in a rear-facing car seat, but after 2 years, they can be in a forward-facing car seat, of course, in the back of the car. N is for nose dives, that's falls, accidental falls. G is for getting burned. This can be electrical outlets, can be stoves, anything like that. E for eating toxins. Teach the parent to always keep all toxic substances, not only things that they ingest, but things they can get on their skin, away from the toddler. R for revolvers and rifles. These are unsecured firearms. Toddlers are very curious about these things and they can go up and pull the trigger, hurt themselves or hurt someone else. And then S for suffocate or choke. So teach the parent about potential foods that the toddler can choke on, keeping plastic bags away from the toddler that could get around their face, and also knowing how to do CPR to relieve a choking toddler. Next is D, diaper to potty transition. So we're talking about toilet training. Now, in order for a toddler to be successfully potty trained, they have to be physically and mentally ready. Because if they're not, it's not going to be successful. And physically ready, what we're talking about are sphincters, specifically the anal sphincter and the urethral sphincter. And these are not really voluntarily controlled until the child's about 18 to 24 months of age. So that's a great time you can start potty training because they're physically ready. Now, bowel control will come before bladder control. And the reason is it's a lot easier to feel when you have to go to have a bowel movement. That sensation is a lot stronger than when you have to void. So most kids are going to be daytime potty trained by the ages of 3 years. One thing you want to remind the parent is that daytime potty training and nighttime potty training are going to be different when the child is independent on it. With daytime, they tend to be a lot faster with that. So with nighttime, going to bed at night, they're probably going to still need a diaper. And most children are trained at about 4 to 5 years of age. So let's talk about those key points that you want to teach the parent about potty training that you may see on an exam. And to help us remember those, we are going to remember the word toilet. So T stands for 2 or more hours with a dry diaper. O stands for on and off the potty by themselves, and they can put on and off their pants all by themselves. I is interested in the potty. They actually are interested in doing this and they want to see if they can. L stands for like sitting on the toilet. This is where they can sit on the toilet for at least 5 to 10 minutes without wanting to get off of it. And then E stands for experiencing regular bowel movements. So they're having regular times that they're passing stool during the day. And then T stands for tells you they have to go. So they can verbally tell you that, hey, I've got to go to the bathroom. Next is D for development stage theory. Now there are 2 theories that you want to know about the toddler's development. We have Piaget and we have Erikson's. So let's talk about Piaget. So with this theory, it really deals with that a person's going to go through these stages, and how they progress through these stages and learn their environment is that they have to interact with their environment and explore it. And they do these in these various stages. So the toddler, depending on their age, because remember the toddler's about 1 to 3 years, that's what we include with this age category, they can be in either the sensory motor or the pre-operational. Sensory motor is birth to 2 years, pre-operational is 2 to 7 years. So some main concepts that you want to remember about the pre-operational is that the toddler has a big problem seeing things from other people's point of view. So they're very much about themselves, so we consider them egocentric. Also, their thinking and how they play and process things is really symbolic. So for instance, if you give a toddler a stick, they may pretend that it's a sword and that the other objects outside are monsters and they're fighting those monsters with their sword. So that's how they process and think and play, which leads me to types of play that the toddler likes to do. And I would remember this. The toddler does what's called parallel play. Now, what is this? This is where the toddler will observe others playing. They will actually go and, let's say, play with some blocks with other children around them, but they won't go and interact with other children, and those children don't really play together in that age category. Now, what are some toys that toddlers love playing with? Well, they love playing with blocks and building them. They also love playing with toys that you can push and pull, because remember at this time, they are really good at walking and they're starting to run. So they love to play with like pretend push lawnmowers, strollers, wagons. They also like to look at books that are interactive, like ones that make sounds or ones that are pop-up, or where you may have to find little hidden things in the book that by pulling up a little cardboard door on the book. Or they like to play with pretend objects like cooking sets, shopping sets, building sets, etc. Now with Erikson's stage of development, you want to remember that the toddler is in autonomy versus shame. So again, this is where the toddler is transitioning to becoming more independent versus so dependent on their caregiver. And in order for them to have got to this stage, they had to get through that first stage, which was in the infant stage, where it's trust versus mistrust. So they have developed trust with their caregiver. Now they feel confident in being able to try things themselves. Plus, they are now discovering that they are an individual separate from their caregiver and that their actions affect people in their environment. So the result of this stage is that the toddler is going to have confidence in completing or attempting new skills like toilet training, feeding themselves, dressing themselves. And as the nurse who may be caring for a toddler who's hospitalized or educating the parents, you want to do the following. You want to provide opportunities for that toddler to be independent, like those things I just named. Give them a chance to try it. Also, give them choices so they feel like they have a say-so, like choices with their food or drinks or activities or books to read. And giving them positive feedback whenever they do a good job completing one of these new skills. That's going to instill confidence in them. And avoiding punishing them when they do that skill wrong. Another thing you want to remember about the toddler, since we're talking about the development, is separation anxiety. Now, in our previous lecture with the infant, we touched on this because this is when this is starting to happen. But with the toddler, this is definitely something that they can experience. And this is whenever they're removed from their caregiver, they experience severe anxiety and they'll cry and things like that. So what you want to know for exams is that you want to know about these 3 stages of separation anxiety and some interventions to help the toddler dealing with this, especially during hospitalization if the parent has to be removed from the child. So the first stage is the protest, and just as the name says, they're going to protest this. They're going to scream and cry, and it's going to be hard to calm them down whenever the parent has left. Then, if the parent still hasn't returned, they can go to the despair phase or stage. This is the second one. And this is where they have quit crying, they're quiet, but just as the name says, despair, they're depressed and they're sad and they're withdrawn and quiet. But whenever the parent comes back, they're going to cry and want the parent and want to be held. And then we have the last stage, which is called the detachment stage. And it's very rare for a child to actually get to this stage, but if they do, they have detached themselves from the parent to help themselves cope with not having the parent around them anymore. So to you, the child will appear happy, like they've coped very well with it, but in reality, they haven't. And whenever a child gets to this, it can actually affect the parent-child relationship. So how, as the nurse, can you help a child who's dealing with separation anxiety as the toddler? Well, if the parent is coming back indeed at a certain time, you can reassure and remind the child that the parent will be coming back. Also, you want to maintain those routines, that schedule of that toddler. Remember, they love rituals. We're going to be talking about that whenever we get to our R of our mnemonic. And encourage the child to talk about their parent. Then we have L, love to say no. Now, no is a toddler's favorite word. And we term this negativism. This is where a toddler is going to do the opposite of what is being asked. They have a negative response to it. It doesn't necessarily mean they don't want to do it, but they're exerting their independence and they're going to tell you no. So as a nurse, what you want to know about this topic is how to avoid getting that no response so you can get your job done. So you want to avoid asking questions or giving commands where that toddler can tell you no. Instead, you want to give them a choice. So let's say it's medication time. So instead of going to that toddler and saying, would you like to take your medicine now? They're going to tell you no. Instead, you can say, you can take your medicine in a blue cup or a green cup. Which one do you choose? And hopefully they're not going to tell you no, and that will help avoid that response. Then we have E for eating plan. So toddlers tend to be what we call grazers. They just like to snack throughout the day. They're not big about setting down for breakfast, lunch, and dinner with large portions. They do better with small, nutritious snacks. So you want to make sure that they have access to finger foods that are like vegetables, fruits, things like that that they can grab and eat. That's going to help them learn those fine motor skills as well. And you want to avoid a lot of sugary, processed, fatty items. The toddler will love those, but they're not good for them to eat. We want to make sure they maintain a healthy weight. Also, another big thing with the toddler is that their teeth are starting to come in. So we want to make sure that they don't get dental decay. Toddlers can experience this, as you can see in this picture here. So how can we educate the parent on how to prevent this? One big thing is avoiding a nighttime bottle, especially with juice in it, because that is going to set on those teeth and cause them to decay. Also, they need to visit the dentist. A lot of people are shocked that they need to go to the dentist around this age. So this is when the teeth start to come in. We talked about in the infant lecture that those lower incisors tend to come in around 8 to 10 months, the central ones. So by 12 months, they need to visit a dentist. Also, they'll need help brushing their teeth with assistance. They can't really brush their teeth all by themselves. They haven't really mastered that skill yet. And you want to assess their water at home. Ask the parent, do you guys have fluoride added to your water? And if they don't, they may need a fluoride application to the teeth. Another thing about the toddler is that this is going to be a phase in their life where most toddlers are going to be considered picky eaters. They are big about how their food looks, and so they're going to be not very excited to eat a bunch of food. Like if they see that there's large amounts of food, they're going to feel very overwhelmed by that and may refuse to eat it. Also, they don't like their food mixed together. So stir fries where you have rice and vegetables and meats mixed together, they probably aren't going to like that. Or casseroles, because a lot of toddlers, they prefer for their meats to be here, vegetables to be here, and fruits to be here. And some toddlers may go as far as requesting that they don't even touch together. They'll refuse to eat that. And they're going to have a limited selection of foods that they like to eat. They may like to eat just macaroni for breakfast, lunch, and dinner, but hey, at least they are eating. So this is not a time for them to try new foods. They'll probably refuse to try something new, but you know, whenever they get older, they will. And if you're having trouble getting your toddler to eat, you have to think of some creative ways. Toddlers are big on rituals, which we're about to talk about here in a moment. So they may prefer to have a certain plate to eat their food on, or a certain cup to drink. They may want certain foods at certain times because that's what they eat every day. They also, some toddlers like fun, colorful plates that might entice them to eat. So sometimes you have to get creative. Now, whenever, because the toddler is starting to eat more complex foods that require chewing, precise chewing, they're still learning this skill. So you want to take care to make sure you're not giving them big chunks of meat. So make sure you chop those up, because they are at risk for choking. So watch foods that are stringy, like for instance celery. That takes a lot of chewing and they can get choked on the strings in the throat. Also hard round candies, or even hot dogs, popcorn, etc. And lastly, we have R for ritualism, rivalry, and regression. So let's talk about ritualism. So this is where the toddler wants to do the same things the same way. Now, why do they want to do this? Well, it's predictable, comfortable, and it will actually help promote learning, because whenever they keep doing the same things, they know what to expect, so they feel comfortable to branch out, try a new skill, because it'll help decrease their stress. Because here in a minute, whenever you see a toddler get stressed, they can actually regress and go down in their skills. So know about ritualism. Then we have rivalry, and we're specifically talking about sibling. So a lot of times whenever a toddler, they hit the age of 2 to 3, a sibling comes along, like a brother or a sister. Now this changes things, and we have learned that toddlers really don't like change. They like their routines. So they can have this because of that. Also, the attention's going to be diverted off of them. So what can happen is that the toddler can start having those temper tantrums, and they can experience regression. So what can you educate the parent about on how to decrease this? Well, one thing is to try to include the toddler as much as possible in the care of that baby. Also, try to maintain important routines to that toddler, to maintain that consistency for them, because breaking the routine really stresses them out. And watch out for jealousy on the part of the toddler, because some toddlers can become so jealous that they may physically try to hit the infant. And then finally, regression. What is this? Well, this is where the toddler actually reverts back to like infancy type skills. For instance, let's say that they've learned to be potty trained, but all of a sudden they're using the bathroom on themselves. Or they were feeding themselves just fine, but now they want a bottle and they refuse to eat, or they're not sleeping at night, or they're talking like a baby, wanting a pacifier, etc. So why does this happen? Well, toddlers learn differently than older children and adults. Toddlers have these bursts of learning in certain stages, hence these milestones, why we can measure and say toddlers should be doing this at this age, etc. Compared to like an adult who builds upon their learning, and they are mentally mature where they can deal with the stresses and failures of not getting that skill right then and there. Compared to a toddler, whenever they're getting overwhelmed and stressed or something stressful going on in their life, they will revert back to like infancy type skills. So some causes that can cause this is that they have a change in their routine. We've learned that routines are so important for toddlers. So if that sibling comes along, or they're hospitalized where things aren't going the way that they go at home, that can cause it. So anything that causes stress. Also, overwhelming them with a new skill where they feel like they just can't get this skill can also cause them to do this. So what are some things that we can do to help the toddler who is going through this? Well, one, we wouldn't want to punish them for not being able to do something, or if they have reverted back. It's going to increase stress and make it worse. Looking at what's causing this regression, possibly being able to remove it or alleviate it so they're not going to be regressing as much. Not taking the time to teach them a new skill, this isn't the time to do that. So let's say they're hospitalized and they're losing their skill of potty training. You wouldn't want to try to potty train them again because that hospitalization is causing that. And taking the time to praise them for what they are doing well instead of focusing on their regression. Now let's talk about the preschooler. The preschooler includes the age range between 3 to 5 years of age. Now, to help us remember all those important concepts we need to know about the preschooler's growth and development, let's remember the word preschool. So first, P. We're talking about physical changes. So our preschooler has went from toddlerhood to now preschoolhood. So with the preschooler, what you have is that they're changing physically. They're starting to look more like a little kid. They're going to start losing that chubby little face. It's going to become more defined. They're also going to start losing that protruding belly as those muscles tighten up, and their limbs start to elongate. So by the end of preschoolhood, you're going to have a little child that is talkative, rambunctious, very active and social, and they're going to have their own little personality. Now, some physical things you want to remember about the preschooler is their height and their weight. So during this time period, they're not having that rapid growth like how they did whenever they were an infant. So it slows down a little bit. So weight-wise, they'll gain about 5 pounds per year, with an average weight for the preschooler towards the end of preschoolhood being about 42 pounds. Their height, they grow about 3 inches per year, with the average height of a preschooler about 44 inches. And then we have gross and fine motor skills. So what are they able to do? So whenever we're talking about gross and fine, what's the difference? Well, gross motor skills require large muscle groups in order to complete that skill. So we're talking about skills like a preschooler should be able to ride a tricycle, they should be able to bounce and catch and throw a ball, run, hop, skip, and climb. And as they progress from 3 to 4 to 5, these skills are going to become really well established. Then we have fine motor skills. And these are skills that use those small muscles that allow us to do things like the preschooler should be able to write their first name, like copy it and write it. So see, you're using your little muscles to do that. They should be able to zip up their jacket, button up their shirt, cut with scissors, copy shapes, like basic shapes like the triangle and the circle. And you can see all of these skills is preparing them for school. So then they'll become school age, which we'll review in our next lecture. Next is R for reduced separation anxiety. So we talked a lot about separation anxiety with the toddler because they really struggle with this. And this is where when the parent is removed from the child will become extremely anxious and will cry and go through these different stages. So with the preschooler, the separation anxiety is going to occur especially in that 3-year-old, but it tends to disappear by the ages of 4 to 5, and it really varies depending on that child. And the thing to remember with the preschooler is that they're going to tolerate separation anxiety a little bit better than the toddler, thank heavens. So what you really want to remember about separation anxiety are those stages and how the child is expected to act in those. So with the preschooler, with the protest stage, that's the first stage, when that parent's removed, it's going to be less intense compared to like with the toddler. Like the toddler freaks out, they scream and cry really loudly, and they're hard to calm down. But with the preschooler, they're going to cry quietly and they're going to act out. Now, the despair and detachment stage is going to be the same as the toddler. Now, one thing you want to remember about our preschooler is that they are magical thinkers. Definitely sear that in your brain because we're going to talk a little bit more about that later. So, the preschooler may be concerned that their parent may never return or that they are hurt or something's wrong with them. And I remember with my preschooler, whenever he was preschool age, he would think that I was kidnapped. Like if I had to go somewhere, he was worried that I'd been kidnapped or something crazy like that. So they are magical thinkers. And so as the nurse, you really want to reassure them frequently that their parent will be coming back and encourage them to talk about the parent. And avoid giving them a specific time when the parent's going to return because the preschooler doesn't understand time. So you can't say, You know, your parent's going to be back at 2 o'clock. They have no idea what that means. Then we have E for Erikson and Piaget's theories. So with these theories, what you want to know is really that stage that preschooler is in. So first, Erikson. With Erikson, we talked about with the infant, that whole goal of that first stage was to develop trust. Then they progress to the second stage, and this is when they're a toddler, and the goal of that stage was to develop autonomy. Now they're in this third stage, and the goal of this stage is for the preschooler to develop a sense of purpose. So we really want to get them there. So the stage for the preschooler that they're in, it's called the initiative versus guilt. So the preschooler, to help progress where they're going to get that sense of purpose, is that they're going to need opportunities to try new things, make decisions, be in situations that challenge them so they can be independent and feel like a sense of purpose. And this is also when their conscience is developed, so they have that simple understanding of right and wrong. Now, if the preschooler is not given these opportunities to do new things, let's say that the caregiver really controls all the choices or belittles them for their decisions, they're going to have issues with trying new things, branching out, being independent, and wanting to make decisions. And then because of that, they're going to experience guilt. So whenever they try to do those things, and they're not going to have a sense of purpose. Now, what are some interventions that we can help the preschooler where they can have a sense of purpose so they can progress to that fourth stage with the school-age child? Well, one thing you can do is to encourage play for the preschooler. Preschoolers learn by playing. They love playing, and that will give them opportunities to try new things, to do things. So you want to make sure you encourage that along with imaginary play, because remember, they're magical thinkers. So encourage that. Also, give them freedom within reason to try new things and to make choices. Allow them to pick. And if they do fail, try to avoid criticizing them, but encourage them and try to accept the choices that they make and avoid trying to control all aspects of choices, but give them some freedom to make those. Then we have Piaget's theory. And with this, the preschooler is in the pre-operational stage. So this overlaps with that toddler because this stage includes children between the ages of 2 to 7. And preschoolers are still egocentric, just like the toddler. So they only really see things from their own point of view. They can't see things from other people's point of view. But as the preschooler is transitioning from being a preschooler to a school-age child, they're going to be able to see things from other people's point of view. Now, the preschooler, as I pointed out earlier, they are magical thinkers, and they love to play pretend. They will have imaginary playmates and things like that, and that really helps their growth and development. So you want to encourage that. And preschoolers are literal thinkers, and this is really funny. If you've ever interacted with a preschooler, and if you say certain metaphorical phrases that are commonly said, they will interpret them literal. And let me share an example with you. My son, it was hot, one day, and I'm like, oh, let's crack a window. And he was like, crack a window? We can't crack a window. And I'm referring to crack a window, like put the window down, let some air in. But he literally thought I was talking about cracking a window to make us cool down. And the preschooler is also, they think of things in an animistic way. And what this means is that they will look at inanimate objects, like their toys, and they will think that they are living, that they're alive, and that they have feelings. And whenever you look at this word, it has the word animal in it, the first part of it, so that will help you remember it. So they think it's alive. And again, my son, whenever he's preschooler, he would do this as well. For instance, he had a little stuffed monkey, and whenever we would eat, the monkey would need to eat as well because he was hungry, and we really had to pretend we were feeding the monkey because he would get full. So they think of their little toys like they're alive. Then we have S for scared of things. The preschooler has real fears because their young mind has problems distinguishing between fact versus fiction. Plus, they're really creative thinkers. And some fears can stem from that animism that we just talked about, where they can think that their toys are alive. And here in this example, you can see a preschooler with this toy dinosaur. It makes really loud noises and it moves in these abrupt ways. And the preschooler is scared. They think that this dinosaur can hurt them, which it cannot because it's a toy.
This toy and it scares him, so I'm going to turn it on and let it walk, and I'll show you how it walks. Yeah, that's what he did. You want me to make him walk again?
No, Papa.
They also fear hospitalizations and procedures. And this is really where you want to be thinking about as the nurse who's going to be taking care of that preschooler. So with hospitalizations, they can fear that the reason that they're in the hospital sick with the illness is because of a punishment, something that they have done wrong. And you have to reassure them that this is not the case. Also, they have a fear of mutilation to their body, especially with procedures that will have to be done, like those invasive procedures. So you have to take a lot of care with the preschooler when you are having to perform those. So let's talk about some interventions prior to like a procedure or during a hospitalization. So with a preschooler, you want to be honest with them. You don't want to lie to them. You want to explain things to them, but in simple terms. They're not ready for in-depth explanations. That comes a lot later. Also, medical play is very essential for the preschooler before you do a procedure. This will help them cope with it. So let's say the preschooler needs an IV. Some things you can do with like medical play is that you can get a doll and show the preschooler how this will be done. Let them participate in giving the doll a pretend IV. Let them look at the equipment, encourage and answer questions. Also, you want to give the preschooler choices and allow them to be as independent as possible given their circumstance with their illness. And be aware that the preschooler can experience a loss of control. And this is where we have disrupted, how they normally go on through their day, like with play, with eating, and being able to do what they normally do on a daily basis. And they'll sense that, hey, I don't have control of this situation. And this will cause them to regress. So be aware of that. That was a big thing with the toddler, but your preschooler can have a regression where they really lose skills and revert back to those infantile behaviors. And then with time, like whenever you're preparing the preschooler for a procedure, you want to avoid telling them a specific time of when it's going to take place. Because again, they have no concept of time and they're not going to understand it. So you want to tell them in stages about as it's about to happen and give them like a time frame where they can relate to it. Like for instance, let's say that they need their IV changed out. You can tell them, we're going to do that after you eat your breakfast. So they know, okay, after I eat breakfast, this is going to happen, instead of saying at 8 o'clock, we're going to do that. They wouldn't understand that. And whenever you are doing any procedure or something that's going to cause that preschooler stress, try to keep the parent with the child if possible, because that'll help alleviate and decrease their anxiety. The next is C for child safety. So our preschooler is not as rambunctious and a danger to themselves like how the toddler was. They're a lot more aware of dangers that can happen, and plus they have some experience to know, oh, I shouldn't do this. This is a little bit dangerous. And you can work with them more, and plus they can follow the rules and obey a lot better. However, there are still some things you want to educate the parent about so they can keep their preschooler protected. One thing is with like gun safety, the importance of always keeping firearms protected away from reach. In addition, swimming. They're going to be active swimming. You don't want them to drown, so you may want to encourage the parent to get them swimming lessons. Also, activities, they're going to be very active using those gross motor skills. So riding bikes, they may, towards the end of preschoolhood, learning to skate. So they want to make sure that the preschooler is wearing helmets to protect their head from any accidental fall with a brain injury, pads on the elbows and the knees. and teaching them about strangers, preventing any type of like child abduction. So teaching them never to trust people they don't know, never to get into a car with a stranger, and always educating the importance of never doing that. And next we have H for healthy eating. So thankfully our preschooler is starting to become less picky about what they eat compared to the toddler. They're going to expand their horizons with their food, and they're going to be more willing to try new foods. Because remember, with the toddler, they were very ritualistic, many toddlers, with how they eat. Like they'll eat just certain foods. They don't really want to try new foods. They're big about textures and how things look. And they're very specific about what plate they have for a certain time, or cup or spoon or whatever. But the preschooler starts to chill out with that. And they're going to actually enjoy setting and eating for meals compared to that toddler. The toddler I term were like grazers. They'll be active, they eat, be active and eat. They're not going to really sit down compared to the preschooler, especially as they approach 5. And thankfully by 3, all those baby teeth have came in, and that's good news for mom and dad, because if you've ever dealt with a child who is teething, it can be very exhausting, to say the least, with some children. They have a rough time with it. So they came in by 3, and then about 5 to 6, depending on the child, every child's different, they'll start losing their teeth. Usually those lower central incisors will be the first ones to go, and then they'll start cutting other teeth, and it's a lot easier this time around when they start cutting teeth. And you'll want to stress to the parent about those dental visits to maintain that teeth integrity. And choking. So with the infant and the toddler, choking was like a big risk, especially with the toddler when they're starting to eat more foods, because they're not really good at chewing and swallowing yet. They're still mastering that. Or a preschooler, you know, they have their teeth, they're swallowing, they're chewing, they're doing great. So they have a little bit of a decreased risk of choking, but you still want to make sure that you're not giving them foods that could potentially cause choking. And you want to teach them about the importance of not running with food in their mouth. Like, for instance, like suckers. They don't want to run with a sucker in their mouth. Or talking with their mouth full, because preschoolers, they have an explosion of their language. They are talking, and they may want to talk with their mouth full, and that could pose a choking risk. Next is O. Others are starting to become important for play. So preschoolers are now starting to transition where they want to incorporate others in their play. So before, like with the infant and with the toddler, they didn't really do that. Like the toddler did parallel play, but now we have progressed from parallel play to associative play. And this is at about 3 years. And this is where the child will be playing with others in a sense that they'll be doing the same activity by using the same toys or the same equipment, but they won't be working together to accomplish something. Instead, they'll be using that equipment or toys to be doing their own activity. And let me give you an example. Okay, we have some children in a sandbox, and they're all using, you know, some shovels and some sand molds. They may even be, you know, borrowing each other's like sand molds and shovels, but they're doing their own activity. They're digging their own sand, they're making their own sand molds, and they're not really communicating to work together with something. Now this type of play is great because it's starting to build those social skills, and it's teaching them those early aspects of sharing and getting along with others. Then we have cooperative play, and this is about 4 to 5 years. Now what happens with this type of play is that the children now start working together and playing together to accomplish something. Hence, they're cooperating with each other. So let me go back to the sand example. You have children together, and they are working together to build a sand castle. So that requires that they get along with each other, that they follow rules. You'll start to see a leader emerge, and along with followers, and then they're all just working together to accomplish something. And then the next O is outline behavior expectations for the parent. So the parent just got out of toddlerhood, and now they're going into preschoolhood. And toddlerhood can be a really trying time for parents because the child is developing cognitively, they're trying to exert their autonomy, they have temper tantrums, regression, negativism, and so forth. So it can be a time where it's really hard. But reassure the parent that parenting is starting to get a lot easier, especially when this child hits 5 years old. So to hang in there. But some things they can expect is that this child can experience what's called loss of control. And I hit on this a little bit earlier with the hospitalization. So whenever the preschooler, is interrupted in how they can play, eat, do things how things normally go, where they have a sense of control, it can cause them anxiety where they can regress. So prepare them for that and let them know that this is why it's happening and to watch out for it. Also, they have those fears and anxieties that we were talking about earlier, and they can have aggression. And this can be due to modeling from seeing a parent who may be aggressive, so they may be modeling their behavior, or media like TV shows that they're watching, so they definitely want to be aware of this. And reassure them, like I said, that negativism and ritualism should be decreasing, where they're not going to be getting a no for everything. And one thing that the preschooler can start having is nightmares. So let the parent know this, and that if this does happen, that they need to reassure their child, listen to their child, explain what happened during the nightmare, let them know that they're there, and help them go back to sleep in their own bed. And then lastly, L for language explosion. So during this time from 3 to 5, this preschooler is really going to make some leaps and bounds in their ability to speak. So by the end of 5, they should be able to speak around 2,400 words, and it really varies among each child, and speak 5-word sentences that are very descriptive, and they're even joining them with those conjunctions and or but. So because we have such an explosion of language, there can be some stammering and stuttering by the child. And this is normal at this age because they're rapidly developing in here. They have this vocabulary in their brain, and so they have to take that and they have to articulate it, and they can have trouble getting that out sometimes. So reassure the parent that, during this time it is normal, but keep an eye on it because we want to identify it early if they do have a speech problem, so they can get a referral and help get it corrected so it doesn't progress into adulthood. So tell the parent to be patient with the child as they speak. Don't try to rush them or finish their word, but listen to them, and to not make a big deal about it at this time or make fun of them or scold them, because they're just really learning how to put their words together with their speech. Now let's talk about the school-age child. When we talk about the school-age child, we're talking about children who fall within the ages of 6 to 12 years old. So the school-age child falls within that range where they quit being a preschooler, but they're not quite yet an adolescent or teenager. So our school-age child, they are really growing and developing and trying to discover their role in this world. And a main driver in helping them do that will be, of course, their parents, but something else is going to be thrown into the mix. This is when they start school. So school is going to be a big driver with this, because they're going to start having that peer-to-peer relationship with other people, and they're going to start having relationships with someone other than their parents, such as their teachers. So this is really going to help them grow and develop. Now, to help us remember all those main concepts we need to know, we're going to remember the word school. So first is S for skills. The school-age child has learned so much up to this point. They started learning whenever they were a baby all the way to the time whenever they were a preschooler. So they're taking those skills, they're mastering them and fine-tuning them, but they're building upon them, and they're becoming very independent with them. So first, let's talk about fine motor skills that they have. Well, these are skills that use those smaller muscles, and one skill that they're going to start getting really good at is writing, and of course school is going to be a main driver with that. So not only are they going to start out writing their name, but they're going to start writing sentences, which are going to evolve into stories. Then they're going to learn how to draw with greater detail. So they'll start out maybe as little stick people here, but then their drawings can start having more detail to them. They can also begin to learn to type and do complex tasks that are required in cooking and cleaning. Next will be gross motor skills. These are skills that use those large muscles. So the school-age child loves to be active, and they definitely are using those larger muscles. So they're going to really learn how to ride their bike without training wheels. They're going to learn how to start using skates and scooters, and they're going to learn to swim. Now, our school-age child loves to compete with their peers and be very active with their peers. So this is the time where they love to be in team sports, competitive sports, and then plus they like to start having hobbies. Next is cognitive skills. So at this age, children have an increased ability to pay attention and to concentrate, which is very useful in the school setting. So now they can memorize and learn material. They can also learn to read, and as time goes on and they practice their reading skills, those skills will even advance even more. Next, they can learn how to solve math problems. So they can go from counting to adding, subtracting, even multiplying and dividing and solving word problems. Plus, they're going to be learning about conservation and classification. They're starting to have those abilities to do that. Next will be their language. So their language is starting to advance and they're fine-tuning it. It's almost adult-like in many ways. So whenever they speak, it will sound a lot like an adult speech. So they can take those words, but now they can write those words out. So they can have creative writing. Plus, you can teach them grammar rules and they can follow those for their writing, and they can even learn how to spell words and write their definitions. And then lastly, social skills. So before, when the child was younger, they were really egocentric, where everything was about them and they didn't really have the ability to see things from other people's perspective. But now that is changing. They're starting to become more concerned about others and their perspective. So this is why you're going to start to see this shift with the child now wanting to form relationships with other people. They'll have these special friendships, especially in the school setting. So with the school-age child, it typically is among the same gender, where girls with girls and boys with boys. But that will change once they approach adolescence. So during this time, you will start to see the child playing with others. There's a variety of play styles that the school-age child engages in, such as cooperative play, competitive play, physical and constructive play. And they love doing this with challenges. So you'll see them maybe play board games, sports, like I said, competitive sports, but they also like to do things by themselves. They like to sit and read, play video games, and like to collect things. And some games you may see a school-age child playing would be like Simon Says, hopscotch, charades, jump rope, kick the can, tag, hide and seek, and so forth. Next is C for changes, and we're talking about the physical changes that that school-age child is going to undergo during this time period. First is height. You can expect them to grow about 2.5 inches per year, with the average 6-year-old being around 45 inches to, whenever they hit 12, about an average of 59 inches. And then weight-wise, they gain about 4.5 to 7 pounds per year. So the average 6-year-old should weigh around 45 pounds. So remember, 45 for the height and the weight. And then an average 12-year-old is around 90 pounds. Now, these averages are just averages, because if a child has the genetics, let's say both of their parents are really tall, well, they're probably going to exceed this height range. So just keep that in mind whenever you look at these figures. Next is their teeth. So before, when they were younger, they were getting their teeth, having to go through all that pain. But now it's time to shed those and get their permanent teeth that they'll have for the rest of their life. So around 5 or 6, most children tend to lose those central incisors, and then they will erupt the brand new permanent teeth. And typically by the end of this age period, about 12 to 13, they will have most of their permanent teeth, with 28 being in. Now, the average adult has 32 permanent teeth. So in a sense, we don't quit teething until we hit around the age of 21, where those last sets come in, those wisdom teeth. So during this time, the nurse definitely wants to provide dental care education. So teach the parent and the child the importance of brushing twice per day and flossing, and going to the dentist regularly, at least twice a year, every 6 months, because we really want to take care of those permanent teeth, because a child's at risk for cavities. If they have any bite problems or really a lot of crowding in their teeth, they may need orthodontics, so they can be evaluated for that. And then lastly, puberty. So as the child is approaching adolescence, their body is going to start changing. Now for girls, this tends to happen earlier than with boys. The girls, the average is anywhere between 8 to 13, and boys is 9 to 14. So as you can see with those ages, it falls within the school age. And with this, you want to make sure that you are educating the child about these potential changes that are happening and what's going on with their body. Next is H for harmful risk. These are safety issues we got to watch out for in the school-age child that you want to educate the parent and the child about, because again, these children are very active and they like to take risks and show off and compete with their peers. So we want to make sure that they're doing that safely. One thing they like to do is they like to get outside and they like to use equipment to play with, such as bikes, skates, and scooters. So we want to make sure that they're wearing protective gear, a helmet on the head, and other protective gear like elbow pads, wrist pads, and knee pads whenever they're using that equipment. Next is swimming. So you want to make sure that they are aware of diving dangers or deep water, like in lakes that could have undercurrents. They want to wear life jackets. And if they haven't already, to consider swimming lessons to help them with their swimming skills. Next, you want to educate them about stranger issues where possible kidnappings could happen, methods that kidnappers use to lure children in to be kidnapped, plus inappropriate touch, what's okay versus what isn't, and fire and gun safety. Keep these things out of children's reach because at this age they're curious. They think they're big enough to play with these things, but they really don't understand how to use them. So keep them in a secure location. And then traffic safety. So during this age range, most children are still in a booster seat. So you want to make sure that you're following state laws with that. For instance, if the child is older than 8 and at least 4'9", they can ride without a booster seat. And then still with 12 and under should always be in the back. They should never sit in the passenger seat. The back is the safest for them. Next is O, obstacles at this age. So during this time, the school-age child is forming self-concept. And this is where the school-age child is going to ask themselves, you know, who am I and how do I fit in? And we want them to walk away from this stage of life having a good self-concept, because if they don't, they may experience depression and have low self-worth that may carry them throughout the rest of their life. So a main driver in helping them develop their concept will be, of course, their parents, but that school setting. For instance, with their peers. Do they fit in with their peers? Do they have the approval of their peers? And their teachers, because the teachers give them their grades and feedback, and that helps them determine, okay, yeah, I'm good at this. Maybe I'm not good at that. I can do this. I excel at that. And drives them with that. So what are some things to help a child with their self-concept that you can educate the parent about? One thing is to be positive and help highlight the child's strengths. Guide them with setting obtainable goals. So whenever they complete those goals, praise them so they feel confident with that. And care about their interests to help them grow in them and let them grow. And when they mess up, help them reflect back on what happened and how to improve next time. Another obstacle is bullying. This is where a child is being harmed or intimidated by another child. And typically this happens in the school setting, but it can happen outside of school. Another common place it's happening is through social media online. Now, boys and girls tend to bully a little bit differently. With boys, it tends to be physical. With girls, it's more of rumors, teasing, mocking, making fun of them. Now, what are some signs that a child is being bullied? You may see physical injuries on the child whenever they come home from school, and whenever you ask them about it, they can't really tell you a good answer of how they got there. They may be missing some school items. They may not want to go to school. They may be faking sickness a lot. Their grades are really poor. They're starting to have behavior changes where, you know, before they were excited about going to school or didn't really care, but now they're starting to withdraw, become agitated and depressed, and you may see suicidal behavior. Now, what are some interventions for this? Well, you don't want to ignore it and hoping that it'll go away, but instead you want to get your child to open up and communicate to you what exactly is going on, their fears and concerns. Just let them know that you care. And then whenever you figure out what's going on, you want to report it immediately to the proper authorities and take an active part in getting it stopped, and let your child know that you want to get it stopped and that you care about them and that you are there for them through this. Next is weight and nutrition. So children at this age are at risk for obesity, known as childhood obesity. And obesity can lead to many health problems in a child, such as high blood pressure, type 2 diabetes, and joint pain. So as a nurse, you want to look at those risk factors with that child and see if they are at risk. And to help you remember those risk factors, remember the word heavy. H is for high caloric diet. So ask the child what they eat on a regular basis and look for things like junk food, fast food, sugary drinks, because these are things that add a lot of calories and not a lot of nutritional needs. E is for exercise lacking. And the U.S. Department of Health and Human Services recommends that children and adolescents ages 6 through 17 do 60 minutes, so 1 hour or more of moderate to vigorous physical exercise daily. A is for accessibility, limited to healthy foods. V is view food as a way to deal with stress. Some children who are experiencing stress at home, in school, or depression will eat to help cope with that. And then Y is your genetics and family dynamics. So how the family members eat, what's prepared on a daily basis, exercise habits, and genetics will determine how a person puts on weight. Now, some educational points you can provide to the child and the family about this issue is to try to make it a family effort. So set weight goals together and change eating patterns together, and to start slow. It'll make it a little bit more funner and make it a little bit more successful. Then to replace junk food the child likes with creative healthy foods. So instead, the child likes lots of candy, try replacing that with vibrant, really pretty, sweet fruits, and to avoid sugary drinks and set a limit on that. And then avoid rewarding with food. You don't want to teach the child that whenever good things happen, it's always associated with food. Use something else as a reward. And to make exercise fun, so try bike trails, team sports, things that will burn calories, but it's fun. And another obstacle children may face during this time period is exposure to drugs, violence, and sexual content through media like social media or the school system. So some educational topics to talk to the parent about, because at some point these topics are definitely going to come up. They want to make sure that they're listening to their children, see what their children's being exposed to, pay attention to who their child's hanging out with, what they're doing on their social media, and to leave an open line of communication. So whenever these topics do come up, that you discuss them honestly, because they're real and they're just going to happen, and ways to deal with them whenever that does happen. Now, during this time, these children, especially as they approach adolescence, are going to start testing limits, and they're highly competitive. They like to win, they don't like to lose. So some behaviors that may start to happen is that they may start to cheat, lie, or steal. Next is the other O, which is for outcome of hospitalizations. So whenever the school-age child is hospitalized, there's some things that the nurse needs to be familiar with that the child can experience during their hospitalization. And one thing is fears. So the school-age child can fear pain/injury, really being stressed that a procedure coming up is going to be painful, or it may cause them a deformity, or they may lose a body part. So as the nurse, you want to be honest with the child. Teach them with visuals, with letting them play with medical equipment, going through it step by step, and helping them develop coping techniques to deal with this. They can also have a fear of death or dying. They're familiar with this concept and that it does happen. They've seen it happen to people around them. And losing independence/control. So in the younger ages, whenever we were talking about like autonomy and losing control, like for instance, like with the toddler, this is a little bit different. The school-age child's loss of control is going to be coming from because they're going to have an interruption into their school routines. When they're hospitalized, they really can't go to school. So that leaves them without being able to see their friends on a regular basis, be part of what's going on in school. They may feel like they're going to get behind, along with being separated from their friends and even their family. So this is different. It's not that separation anxiety like our younger children had. It's more, I don't get to see them, are they going to forget about me type thing. And then another thing is modesty. So as that school-age child gets older, they start to become aware of how it feels uncomfortable to expose your private parts. So if you have to do procedures that expose them, you want to take care that you are preserving modesty and that you're letting the child know that you are taking those steps. Now, as a nurse, there are some things that we need to remember as our role whenever we are taking care of the hospitalized school-age child. So I want you to remember the 7 T's. The first T is to take time to let them express fears, and then let them talk about those fears and coping techniques to maintain control and be truthful about procedures and tests. All of that is going to help decrease their fear and anxiety about, the hospitalization and what's coming up. And when you have to teach them with pictures, outlines, age-appropriate videos, and medical equipment, and lay out how it will happen step by step. And be tactful with privacy, especially during procedures that expose their private parts. We want to maintain modesty. And then give them time for activities throughout the day. This is going to help provide distraction from the sickness, the hospitalization itself, and upcoming procedures. And plus, they start to get a little restless and bored when they're hospitalized, and that'll help pass the time. And then lastly, their friends. Keeping in communication with school friends is really important. So collaborate with the parents on how they can still stay in contact with their friends while they are hospitalized. And then the last part of our mnemonic is L. Learn developmental theories for the school-age child. One of those theories you want to know is by Erikson, and specifically what you want to know is what stage this child is in. The school-age child is in the industry versus inferiority stage. Now, our school-age child is very industrious. They yearn to accomplish things because whenever they accomplish and succeed at things, it instills satisfaction in them. They feel confident. And the whole goal of this stage, in order for them to progress to the other stages, is to have competency. So we want our child to walk away from this stage with a sense of competency. Now, this is really cultivated in a lot of settings, like in school, in sports, and with their schoolwork, because once they succeed at things, they're able to do it. It's like, hey, I can do it. Everyone else can do it. I feel competent. I'm knowing my role in this world. Now, what can happen is that they can struggle with feeling inferior, like inferiority. And what can happen with this is if a child has a physical limitation that prevents them from being able to accomplish something, or maybe they just don't have the talent to do it, so they feel inferior. So what we need to do with that, whenever that occurs, is help the children be able to cope with this. Let them know that not everyone can master everything. Sometimes it takes time. And just point out what things they are good in so they don't go there, because whenever they start to feel that way, it can lead to low self-esteem and just cause them to not really want to try anymore, to try to accomplish things. And then the next theory you want to be familiar with is Piaget's. So up till the age of 7, they're in the pre-operational stage, but whenever they get to 7 to 12, they're in the concrete operations. So remember, concrete operations. So our child is losing their egocentric thinking. They're starting to know that, hey, other people have opinions and perspectives, and they're turning into concrete thinkers, which is really going to help them learn skills and understand the world around them. We're not here at abstract thinking yet. That comes a little bit later. So with concrete thinking, with statements, they take it as it is said. They don't think beyond it or other scenarios or really look at that deep hidden meaning. That's a little bit later on. So here, as the child starts really going from 6 to 12, they're going to start being able to develop some skills such as conservation and classification. So let me give you an example of conservation. So let's say we have 2 plates. They're the same exact size, and I put 1 scoop of food, and it's the same amount of food on each plate. Well, I'm going to now remove one of those plates and put a smaller plate, but I'm going to keep that same amount of food on that plate. So whenever I have a child who, let's say, is a preschooler, they look at that, they're going to look at that smaller plate, and they're going to think that there's more food on that smaller plate than that larger plate. But if I have a child who, let's say, 8 or 9, whenever they look at that plate and see what I did, they're going to say, hey, that's the same amount of food, you just switched the plate and made it smaller. So they were able to see the difference where that younger kid wasn't. Now, another thing that children can start doing is they can start classifying objects. So they can start to group objects based on their color, their size, and their weight, or even what that tool or specific thing is used for. And then the last theory deals with moral development by Kohlberg. So whenever we're talking about rules and conforming to rules, different age groups are going to do it for different reasons. So early on, up till the age of 7, a child is going to conform to the rules based on a reward that they get or a punishment they get. So if they act good, they get a reward. If they act bad, they get punished. But they don't really understand the meaning behind these rules and why they are there. Then as the child ages up till about the age of 10, they're going to start conforming to the rules because it lets people know around them that they are good. If they have good behavior, people are going to know them as being a good boy or a good girl. So this is known as the good boy or nice girl orientation. Then as they get a little bit older, towards the end of this age range, the child is going to conform to the rules because of law and order orientation. So they follow the rules because that is what society says and it's good for social order. Finally, let's talk about the adolescent age group. The adolescent, also called the teenager, falls within the age range of 13 to 18 or 19 years of age. Now during adolescence, there's a lot of changes that are occurring. This child is changing physically, emotionally, and cognitively. And if you look at a 13-year-old and then compare them to an 18 or 19-year-old, you're going to see there is a difference in how they look. They should look more adult-like. Also, they should be more mature in their thinking abilities and their skills. So adolescence is a very challenging time for a child because they are dealing with all of those changes physically that our younger age groups really didn't have to deal with. Plus, they're trying to find their identity, dealing with their body image, and trying to maintain relationships because peers are really important to them. So to help us remember all those important concepts about the adolescent, we're going to remember the word teen. So T is for the big changes, and one huge change we're dealing with during this age range is puberty. And puberty, what it is where the reproductive organs are becoming active. Hence, that person's going to become sexually mature and they can make offspring. So they're going from child to adult. And what becomes active for the girls are the ovaries and boys the testes. Now let's look at some quick facts about puberty. So girls tend to start puberty about 2 years earlier than boys, and puberty lasts about 5 years. So all these changes that person is undergoing doesn't happen over a month or two. It happens in stages over this time period. Therefore, you can look at the changes that are occurring in a girl or a boy and determine how far along they are in puberty. So you can use what's called Tanner stages, and this is a 1 to 5 point scale, with 5 being the most mature. So for girls, it looks at the breast development and the growth of pubic hair, and in boys, it looks at the genital area, the enlargement of the penis and the scrotum and the pubic hair. So first, let's go over the changes of puberty for a girl. Now, girls tend to start puberty anywhere between 8 to 13 years of age. And the first sign that a girl is starting puberty is that there will be breast changes, so the development of breasts. Other changes that will happen to that girl throughout puberty is that there will be an increase of hair growth, which will be under the armpits and in the pubic region. And there will also be the increase of weight. So fat is now going to start to be stored on the abdomen, the butt, and the thighs. Also, the hips are going to widen over time as well. So the average weight for a girl in the US that's 18 years old is about 125 pounds. And then there's the increase in height. So for both girls and boys, this is a time of major growth. So depending on the female's genetics and other factors, she could potentially grow up to 8 inches during this time period. So the average height for a female in the US that's 18 is about 64 inches, so 5'4". Now the thing with girls is that they tend to stop growing 2 years after menstruation. So once they get their period, 2 years after that, they will typically quit increasing in their height. And menstruation tends to occur about 2 to 3 years after puberty starts. Now, other changes that occur, not only do we have our reproductive organs like our ovaries being active, but other things start to become active, like glands. And we're talking about the sebaceous and the apocrine glands. So sebaceous glands secrete oil, so there's going to be an increased risk of acne developing, zits, pimples, and the apocrine glands, which are sweat glands. And this can increase the amount of sweat that the person puts out, plus it can lead to body odor. And finally, there are emotional changes during this time as well, because we have hormones involved, especially with the ovaries, things being released like estrogen. So we can have emotional emotional outbursts, mood swings, irritability, and some depression. Now let's look at puberty changes for boys. So boys can enter puberty anywhere between 9 to 14 years of age. And what happens is that the penis and the testes will start to increase in size. Also, there will be an increase of hair growth. So you'll start to see an increase of hair growth under the armpits and the pubic area, on the chest, the legs, the arms, and even the face. There will also be voice changes. So at first, it may sound like that boy's voice is just squeaky and starting to crack, but as time goes on, it will start to become deepened. And you can actually see these changes because the larynx on the throat will start to increase in size, and we refer to this as the Adam's apple. So you can start to see that. Now the larynx does increase in size on girls, but it's not as prominent as it is in boys. And that's just telling us that we have voice box changes. There will also be the increase in weight. And this is due to the increase of muscle mass this boy is putting on. The average weight for a boy in the US that's 18 is about 147.5 pounds. There will also be the increase in height. So during this time, the boy could increase by a foot in their height, with the average 18-year-old boy here in the US with a height of 69.3 inches. And boys tend to keep growing until they're about 20 years of age. Other changes that occur are similar to the girls with their skin. Those glands become active, so they get those problems. And they will have emotional challenges as well because reproductive organs are becoming active, so we have testosterone on board along with other things which can lead to moodiness and agitation. Now some other changes that the adolescent will be going through will be some teeth changes. So before, with our younger age groups, we were cutting teeth, we were losing teeth, but now we're starting to wrap up that process where we're going to fine tune and have all of our nice 32 permanent teeth. So by the age of 13, they should cut their second molars, and then by the age of 17 to 21, those last set of molars, the wisdom teeth, will come in. So during this time, some adolescents have braces to correct any crowding or other orthodontic issues. So it's important you stress that they go to the dentist regularly, at least twice a year, every 6 months, and the importance of continuing to brush their teeth twice a day and to floss daily. Plus, the adolescent is changing socially. So before, during the school age time, friends were important. They were starting to love to hang out with their friends. But now, peer influence is a major part of the teen's life. They will dress how their friends dress, consume the foods that their friends consumed, and do the same activities as them. And there's a lot of peer pressure during this time period. So what teens like to do for fun is that they like to keep into contact with their friends. So this will include text messaging, using social apps, talking on the phone, surfing the internet. They may also be working at jobs, they like to go to the movies, and they just like to hang out with their best friend groups and have a close relationship with them, and then they may even play competitive sports. Now during this time, the relationship between the child and the parent is also changing because they are starting to separate from their parents and challenge their authority. This is all very normal. So they are yearning for independence and they don't want to be restricted by rules, especially the older they get. So the child and the parent relationship can become strained, but once the child becomes an adult and they mature, the relationship can actually become really close. But during this time, they need to branch out and find their identity. So with all these changes that are occurring to the teen during this time period, it can lead some teens to feel not too sure about these changes. And then plus, when you throw on peer influence, it could possibly lead to a negative body image. So let's talk about body image for a second. So body image is how you view your body. And if you don't have a positive body image about yourself, it can really affect how you view yourself, like self-esteem, your self-concept, which in the end can lead to depression and eating disorders. And this isn't a thing that just affects girls. It also affects boys as well. Now, during the time that we live, this generation faces more challenges because we have the internet, which bombards us with media and social media, and it's constantly showing us what's pretty versus not what's pretty, what's the ideal body and what isn't the ideal body. So with this, teens, they like to use social apps, and one thing they like to do is they like to post pictures and post videos, and they get feedback on those. And if they're not getting the feedback that they want, it could lead to a negative body image. Or they're looking at other people, their friends or celebrities, and they see these pictures. And these pictures sometimes aren't what really is reality. It may be filtered, it may be manipulated, but to them, that's what it really is. So it can lead to problems. And one thing, an interesting article by the Mayo Clinic was talking about how teenagers are really affected by social media. And this is one thing it said in the article, and I quote, "A 2015 study found that social comparison and feedback seeking by teens using social media and cell phones was linked to depressive symptoms." So this is something that we really need to help the teen understand and help them not have a negative body image. So what are some things that we can do? Well, we want to be real with that teen. So one thing is to be a role model for that teen. So as a parent or whoever is with that teen a lot, you want to make sure that you yourself have a positive body image and that you put an importance on being healthy rather than looking a certain way or having a certain weight. And if you struggled with this as well, share that with the teen to let them know that this is something that people struggle with. E is for eating disorder signs. So you want to be looking for signs and symptoms that your teen may have an eating disorder. One eating disorder is anorexia. This will present with where the teen won't eat, they'll restrict food, they will be obsessive about losing weight, exercising, they'll be negative about themselves. Or there's also an eating disorder called bulimia, and this is where the teen may consume lots of food and then they will just run to the bathroom and throw up afterwards. They'll do this a lot, or they will use laxatives. Next is to avoid the media trap, and I touched on this just moments ago, but you want to make sure that there's understood rules for how the teen should use social media and talk to the teen about how not everything you see on TV or in a magazine is necessarily how a person looks or how their life is. And then lastly, love the teen. So let that teen know that you love them and that you care for them, and don't concentrate on how they look or on other people's looks, but qualities, and praise them and build them up and help them to feel confident. The next part of our mnemonic is E for education. So these are the educational points you want to go over with the teen to help promote their safety, because this is actually a dangerous time for the teen due to accidents that could lead to death. So we have the teenager, their body has changed physically, they're adult-like, they have amazing strength and endurance. So they have maturity in some things, but in some things not so much. And some teens just really don't have a great ability to really see the consequences that are going to happen. Like, yeah, they know it could happen, but they think, that's not going to happen to me. That happens to everyone else. I'm mortal. So they engage in like risky activities. One thing that is big during this age time is driving. Around 16, that is when most teenagers start to drive. So that leads to a lot of dangers. And unfortunately, according to the CDC.gov, motor vehicle fatality is the leading cause of accident death among teenagers, representing over 1/3 of all deaths to teenagers. So as you can see, driving safety is really important for the teenager. So some things you want to include in education would be taking a driving course, which is usually offered by most high schools. The importance of always wearing a seatbelt, whether you're driving the car or if you're a passenger in a car. Rules on driving, so who you can ride with, who you can't ride with, not text messaging while you're driving or using your cell phone, and not driving under the influence of any substance. And some other safety concerns would be self-harm, like suicide. And unfortunately, a recent article by UCLA Health said that suicide is the second leading cause of death in people ages 15 to 24 in the US. So as a nurse, you want to make sure you're assessing for those risks of suicide, which could include the following: leaving messages on social media or hints telling you that they want to die, telling people goodbye, they quit socializing all of a sudden, they have outbursts of anger or depression, giving away things they own, express being a letdown to others and saying life would be better without them, having a plan that they have written or shared with you, or they've experienced a recent traumatic event like a death of someone, they're being bullied, or a rejection. And if the adolescent is displaying any of these signs, you want to get them help immediately via a mental health facility. So in addition to the safety concerns with self-harm, there's concerns about substance abuse, because teens can be around other teens or other people who are using substances. They may feel pressured to use those because they want to fit in with the peer group, or they're rebelling against their parents. So you want to make sure you discuss with the teen substances that they may come into contact with and how to handle those situations. And also discuss swimming dangers, sports, make sure they're wearing that protective gear to protect their head and other organs, dangers with gangs and firearms. Next is health education, and there's several categories you want to discuss with them about this. One is sleep. So make sure the teen understands that they need at least 8 to 10 hours of sleep per night. It's going to help them feel better throughout the day, help them with their mood. It decreases the risk of obesity. And believe it or not, you do a lot of your growing at night as a teenager because that's when your growth hormone is secreted. So some things that can affect sleep is that staying up too late, so you don't go to bed until 11 or 12, and then you have to get up really early for school. You're not getting in that time. So you want to set a schedule and say, hey, I'm going to sleep at this time every night so I can get that period of time of sleep. Also, teens like to use devices, you know, they're on their cell phone a lot or computer or any device that puts out that blue light. That blue light can affect your ability to sleep throughout the night. It messes with your sleep cycle. So you want to make sure that you're limiting your device usage before bedtime. Also, they need to know that they need to exercise at least 1 hour every day, moderate to vigorous exercise to help just promote health and decrease obesity. And they need sex education along with nutritional education. So during this time, they are growing. And as you've seen, they can grow a lot of inches throughout this time, and their body is just changing with hair growth, the increase in muscle mass, etc. So we need to make sure that they are consuming enough minerals and vitamins to facilitate that growth. So they want to make sure they consume good calcium, iron, protein, folic acid, zinc, and vitamin D. Now the teenager, again, they have a lot of social influence. They are busy with school and other activities, so they may not consume what they need. Now, why would they not consume? What are some reasons why teenagers have poor nutrition? Well, one thing obviously is that their life becomes very busy with activities, friends, and other commitments. And it's just easier to eat foods that are high in calories and really don't have nutrition. Plus, parents' influence on food choices is limited. They are eating and drinking what their peers drink, and that includes usually a lot of soft drinks, energy drinks, or coffee type products where, you know, there's going to be less milk and water intake. And they may have a negative body image. So they may start skipping meals thinking that will help with weight loss, or they may overeat to cope with stress, which could lead to obesity. So as a nurse, you're going to be measuring their height and measuring their weight, and you want to see what their BMI is. So here's the following BMI chart for the teen. They are considered underweight if their BMI is less than 5th percentile for the age, height, and gender. Normal if the BMI is 5th percentile or greater, but not higher than 85th percentile. Overweight if BMI is 85th percentile or greater, but less than 95th percentile. And obese if BMI is 95th percentile or greater. Next, we have our other E for Erikson's, Piaget, and Kohlberg's theories. So for exams, you definitely want to be familiar with these theories for the adolescent. First, I want to talk about Erikson's psychosocial development theories. So the stage that the adolescent is in that you need to remember is identity versus role confusion. So the teen is independent. They're allowed to get out, experience the world, of course, with their parents' somewhat supervision. And this really helps them form their identity because they're going to be in different social relationships and other experiences, which is going to help them grow and explore and figure out who they are and what they want to do. So this is going to drive them in their future relationships, their careers, and goals. So the goal of this stage before we can get to the next is for this person to get fidelity. And this is where they have a commitment or faithfulness to obligations. So if we can get them to form an identity, they will become a stable, productive person who is faithful to their obligations in life or duties. Now, they can enter in with role confusion where they get confused about who am I? What am I supposed to do? So what can happen is they become unsure of themselves and they sort of just drift around in their educational, career, and relationship pursuits and really can't settle on anything because they really don't have an identity. Then next, we have Piaget's theory on cognitive development. So you want to remember that the adolescent is in the formal operational stage, and this is ages 12 years to adulthood. So our adolescent is really mature in their thinking. They went from being concrete thinkers, like how our school-age children were, to more abstract thinkers. They can plan for their future, especially later on through this age range. They're starting to understand cause and effect, and they can hypothesize. They can manipulate ideas or situations in their mind without actually seeing it, and they can solve problems in their mind without actually having to figure it out on paper, actually see it. So they're really advancing in their thinking abilities. And then next is Kohlberg's moral development theory. And the adolescent is in the social contract orientation period. So we know that the teen knows that others have different ideas on what is right or wrong. Hence, everyone has their own moral values. So the teen, yes, understands that we have laws and rules that majority of people agree on, although some groups of people will disagree on them. But everyone will try to work together, hence reciprocate, or have like a social contract to follow these rules and laws so society can exist and function. However, the teenager is starting to understand that people have rights and basic human freedoms and moral personal values they follow. And if laws and rules hinder or go against these, there's an exception for the rules or the laws. So they're starting to understand that people may not follow the rules or the laws if it goes against their personal values. And then the last part of our mnemonic is N for nurse's role with the hospitalized teen. So whenever the teen is hospitalized, there's some things you want to be aware of, especially their fears. So some fears that the teen will have will be separation from their peers. Before, with our younger children, it was separation from their parents. And in the school-age child, yeah, there was separation from peers. They didn't want to be forgotten about. But this is a little bit deeper for the adolescent. It's fear of being rejected, that they're no longer going to be part of the group because they're not there. Another thing is loss of control. And again, this is different. We're in there, we're interrupting their way that they live, we're invading their privacy, which is another thing that they fear, and they're not being able to be independent and do what they normally do throughout the day with school and friends. So they've lost control, and the teenager will act out. They may get really angry, they may refuse to do something, and that when they do that, that gives them a sense of control. I already touched on privacy invaded, so with that, make sure you are taking that into account and letting them have their time in their room, and that if you have to do anything that shows private parts, that you take care to cover them up as much as possible. And then they have a fear of death and becoming deformed, because remember, body image is a huge thing for teenagers because they're changing. They have peer influence. So you want to take all that into account. Therefore, there are some interventions we need to remember as the nurse to help the teen with dealing with these fears. One thing we can do is be completely open and honest with the teenager about procedures, about things that are coming up, because teenagers are really good at knowing if you're being for real or not. And they may hide their feelings, so not really communicate if they're scared or anxious, or ask you certain questions. They won't. They'll avoid doing that. So as a nurse, you want to anticipate questions that they're going to have about certain things and answer them without them having to actually ask the question. You also want to give them as much control as possible in decisions and activities. So if possible, let them eat food that they want to eat. Have their parents or someone bring them food. Let them wear their pajamas instead of that not so nice looking gown in the hospital, and let them have their own routines if possible. Also encourage social activities. If there's a recreation room on your unit, incorporate the teen as much as possible and get other teens involved so they can socialize and maintain privacy. And whenever you have to teach them with creative ways, such as with videos that are age appropriate, diagrams, photos, and again, encourage questions and anticipate those questions. Okay, so that wraps up this comprehensive video on growth and development. And don't forget to access the free quiz below to test your knowledge on this content.